Hello, everyone. My name is Kelly Kazi, and I'm the president and CEO of the Colorado Children's Campaign. Welcome to the release of the 2022 Kids Count in Colorado report. We are so excited to spend the afternoon with you all, partners, policymakers, funders, community leaders, and of course, fierce child advocates to talk through the current conditions faced by Colorado kids. As in past years, our annual publication digs deep to understand how Colorado children are faring across more than 40 indicators of child well-being, and importantly, to identify opportunities for action to better support the kids in our state. We are grateful to have you by our side for this essential work. Before we officially begin, a few housekeeping items. We're anticipating having a big group on the call today, which is fantastic. So we just ask that you please remember to mute yourselves during the presentation. We've also saved some time for Q&A at the end of today's call. So if questions pop up at any point for you throughout the presentation, then please feel free to drop them in the chat box and our staff will answer as many as we can during the Q&A portion. So with that, let's get started. So the Children's Campaign has been proudly producing Kids Count in Colorado for nearly 30 years now. We hope that throughout its history, it's been a useful tool in the work that you do in your corner of Colorado to make our state a great place to be a kid. For those who are new to the Kids Count project, let me share just a little bit of background about the report before our staff dive into the data and the policy recommendations. So Kids Count in Colorado is part of the Annie Casey Foundation's National Kids Count project. The report tracks child well-being at both the state and the county levels in the areas of family economic security, child and family health, early childhood learning and development, and K through 12 education. It serves as an important source of quality, non-biased information on children and families for decision makers and for child advocates. This year's edition captures how the pandemic continues to impact children and families in ways that we couldn't have anticipated at the beginning of the public health crisis, and offers recommendations for policy action to support Colorado children in the years ahead. We hope the information that you hear today will help support your work, and we thank you for joining us in our commitment to ensuring every chance for every child. And now I'm going to hand it over to Julia McCorvey, our grants manager.
Hi, everyone. My name is Julia McCorvey, and as Kelly said, I am the grants manager at the Children's Campaign. We want to take a moment to thank our funders who generally support this essential report. So this 2022 edition of Kids Count is made possible through the support of the Annie E. Casey Foundation, the Buell Foundation, the Anschutz Foundation, the Colorado Trust, the J. and Rose Phillips Foundation, and El Pomar Foundation. Thank you so much for your generous support. And with that, I will give it back to Sarah Hughes.
Thank you, Julia, and thank you all so much for joining us today. At least here in the Denver metro area, it's a beautiful sunshiny day, and so we appreciate the fact that you are choosing to spend your lunch hour not in the sunshine necessarily, but here with us for a data presentation. Like everyone mentioned, we are so excited to be able to introduce our 2020 Kids Count report to everyone that's on the call today, and examine how kids and families are doing after more than 2 years of pandemic life here in Colorado, and most importantly, to talk through solutions for the challenges that we know people are facing. Now, this photo that you see here comes from March 2021, when a lot of schools were resuming in-person learning, and it probably looks pretty different from what you would see if you walked into a classroom here in Colorado today, as a lot of our schools are getting back in session. And I think that's true for a lot of different aspects of our lives right now. If you look around here, nearly 2.5 years into the pandemic, you'll probably see some signs that many aspects aspects of our lives are getting back to normal or getting back to the way that they were before COVID hit. Mask mandates have lifted, schools are back in session in person to the delight of many parents who no longer have to serve as Zoom teachers. You can, let's see, my slides freeze a little bit from time to time, I apologize. You can go grocery shopping and our grocery store shelves are not barren anymore. You can usually find toilet paper when you need it. And then when we turn on our TVs at night or look at the news on our phone, we're no longer seeing this steady stream of images of exhausted healthcare workers who are working around the clock to care for people with COVID. All of these things that sort of early in the pandemic were really clear signs that something isn't right here. Things are not normal. We're really grappling with a crisis as a state and as a country. And with some of these more visible reminders of pandemic life sort of fading into the background, it can be really easy and tempting to think, okay, we can just get back to normal. We can get back to business as usual. We can just move forward and put the worst parts of the pandemic behind us. But as we were sifting through mountains of data to put this year's Kids Count report together, it was clear that even though many parts of life have started to appear more normal and feel more normal than like they did before COVID, that the effects that the pandemic has had on Colorado kids are far from over. And there are lots of ways to tell the story of COVID in Colorado. The case, hospitalization, and death numbers certainly tell a story that is sobering all on its own. So here in Colorado, in the first 2 years of the pandemic, more than 1 million people in our state had tested positive for the virus. It claimed the lives of more than 13,000 people in our state. And included in this number are folks who were undoubtedly loved by the kids in their lives: parents, grandparents, aunts, uncles, childcare providers, teachers, folks who really probably left a big hole in the lives of the children that they cared for. So that alone is a significant impact. Then if we look at our child-specific numbers, we can see that, again, in the first 2 years of the pandemic, more than 265,000 kids in our state had tested positive for the virus. More than 2,000 had been hospitalized with COVID-19, and 31 kids in our state tragically lost their lives to COVID-19. And these numbers alone are enough to stop you in your tracks. But the true toll of the pandemic on Colorado kids stretches a lot further than that. And to fully understand the impact that the past 2.5 years have had on kids and families in our state, we have to also look at data on their family economic security, their health, both physical and mental, their early learning opportunities, and their educational experiences. And when we do take this sort of big picture look at child well-being and assessing the pandemic's impact, two things are really clear. Number one, the public health crisis has created new challenges or exacerbated pre-existing ones across every part of kids' lives. And number two, many of the challenges that were generating a lot of attention early in the pandemic, things like food insecurity, mental health challenges, childcare disruptions, those things have not gone away. They are still very much present in the lives of families with children across Colorado. And we can't lose sight of that. As advocates for kids, as community leaders, it is critical that we not let the needs of our kids and families fade into the background as we sort of get used to living with COVID-19. And we're already seeing some evidence that that is happening. Just in the last week, Congress passed and President Biden signed into law the Inflation Reduction Act, which does really great things in the areas of healthcare and climate. But it did not address so many of the things that parents and families have really been yelling from the rooftops for since the pandemic started. Things like paid family leave, things like universal pre-K, continuing monthly child tax credit payments, more funding for childcare providers so that they can keep their doors open and so that families can access care. And so it's really vital that we keep raising our voices with our leaders and our elected officials to ensure that they are going to be responsive to the challenges that kids and their caregivers are still facing here in Colorado 2.5 years into the pandemic. And so more than anything, we really hope that today's presentation and that the data included in this year's report will help you in your work to do that, because we know that we have some amazing advocates and policymakers on this call, and our data are really here to serve you and the fantastic work that you're doing. So with that, I will go ahead and briefly turn things over to my colleague, Erica Monowatzel, who's going to talk a little bit about some of the considerations that are important to keep in mind as we go through the data in this year's report.
Thanks, Sarah. My name is Erica Monowatzel. I work as the Manager of Research Initiatives at the Children's Campaign. Along with Sarah, I'm one of the authors of this report. So a couple of essential considerations when we're talking through the data today. Many of our major indicators that we feature in this report every year come from the American Community Survey, which is conducted by the U.S. Census Bureau. And in 2020, the department conducted that survey, but there were some pretty significant disruptions to the operations of the survey because of the pandemic. And so what resulted from that is the data that came back did not meet the quality standards of the Census Bureau. So we saw that in general, households who responded to the 2020 survey, they tended to be different than households who didn't respond. For example, households who responded tended to have higher incomes, they tended to have higher levels of education, and they were also more likely to be US citizens. And so the Census Bureau used new methodology to account for this bias in the response patterns, which yields for 2020 what are called experimental estimates. And what this means is that some of the estimates that we talked through today, for example, the estimate we look at for our child poverty rate, is an experimental estimate, and it is not comparable to previous years of data because of the change in methodology. And so that limits our ability to track trends in, again, child poverty, but also in uninsured rates and other important measures of child well-being. The experimental estimates also cover a much more limited range than we would typically receive from the ACS. So they're only available for the nation, states, and the District of Columbia. So we also have, there are limitations in terms of the amount of data available at the county and local levels. These data constraints are significant, and they have implications for all of us who work to advocate for children. We have to be willing and ready to use experimental and non-traditional data sources to better understand the impacts of child well-being during this time period. And we have to be able to explain the limitations of those data clearly to let people know what those data are saying and what they're not saying. And so throughout this presentation and throughout our report, you'll see that we clarify when figures are not comparable to previous years. And we also bring in fresh, sometimes less traditional data sources to further tell a story around the impacts of the pandemic. So I will give it back to Sarah to jump into our family economic security slides.
Great. Thank you so much, Erica. That's really important information to keep in mind throughout the presentation, and also on this first slide where we talk about child poverty in Colorado. This is a graph that shows the child poverty rate here in our state in the 2 decades that sort of preceded COVID-19. And what we can see here is that prior to the pandemic, Colorado's child poverty rate was headed in the right direction. It had dropped pretty steadily year after year since 2012, falling from 18% of kids experiencing poverty across the state to 11% in 2019, which was almost a 20-year low. So encouraging trends here before the pandemic hit. And I think it's important to keep in mind here throughout this section that when we talk about poverty, we're really talking about only $26,000 a year in annual income for a family of 4. Anyone who has a family of 4 knows that that number is not realistic for what it takes to be able to meet a family's basic needs. And so it's important to keep in mind that these poverty numbers, even though we were seeing good news here, this is definitely an underestimate of the number of families that are struggling to make ends meet because we're using such a conservative measure of what it takes a family to get by on. Now, I know the big question with poverty is how did the pandemic affect it? You know, we were seeing rising unemployment rates. We were seeing lots of people out of work. People, myself included, were really excited to get 2020 numbers and be able to see how the pandemic had affected poverty in our state. But unfortunately, due to those data constraints that Erica shared, we're not able to make comparisons and say definitively how child poverty changed here in Colorado between 2019 and 2020. We do have those experimental estimates from the Census Bureau, and that's what you see here. And these can show us that an estimated 10% of kids across Colorado, so almost 130,000 kids, experienced poverty in 2020. We can see that our poverty rate for kids was below the national average of 16%, but what we can't tell is how things changed from before the pandemic, since those estimates are not comparable to what we had in previous years. However, poverty is really just one indicator of economic hardship for families, and other indicators point to really ongoing economic struggles for Colorado families with children. And we can take the unemployment rate, for example. So in February of 2020, just before the pandemic hit in Colorado, our state's unemployment rate was at 2.8%, so very, very low levels. 2 months later, in the midst of stay-at-home orders, we saw more than 12% of Coloradans unemployed, a really, really staggering number. Now, thankfully, we did see that number come back down in subsequent months, but even as of December 2021, so over a year and a half into the pandemic, the unemployment rate for people in our state was still almost 5%, still 2 percentage points higher than it was before the pandemic started, which just goes to show, again, that families are still really feeling the effects of the pandemic on their wallets and on their abilities to provide for their children. And the employment landscape also looks different depending on which Colorado community you're looking at. This is a map that shows the change in county level unemployment rates between February 2020, so pre-pandemic, and then November of 2021, which were the most recent estimates available when we were putting the report together. And when you look at things on a county level, it's a couple things become clear. Number one, we see that unemployment rates, even in November 2021, were higher than their pre-pandemic levels in all but 7 counties across the state. And then our rural resort communities, those counties that you see shaded there in the darkest blue, they were hit particularly hard, and the impact has been pretty long lasting when it comes to employment in those communities. So all of those dark blue counties that you see shaded there as of November 2021 had unemployment rates that were still more than double what they were before the pandemic. So again, indicating ongoing economic struggles for families in those communities long after the sort of acute phase of the pandemic economic fallout happened. And then we can also look at, my slides will move, indicators from the US Census Bureau's Household Pulse Survey, which was designed to capture families' experiences or people's experiences during the pandemic, and some data from the US Department of Housing and Urban Development. The Household Pulse Survey data show that among Colorado households with children, about half have reported a loss of household income since the pandemic began, a really, again, staggering number. And then as of early 2022, about a third of the households with kids in our state were still reporting difficulty paying for usual household expenses, things like medical care and food. And I think it's really important to look at the time frame on that statistic, because again, that's 2 years into the pandemic, and that percentage is on par with what we were seeing in the pandemic's earliest days. So again, even though things feel like they're getting back to normal, we are still seeing a lot of families facing difficulty paying for those basic things that we know every child needs and deserves. And then, of course, anyone in Colorado knows that we have, for a while now, had a real crisis when it comes to affordable housing in our state. And the pandemic really exacerbated this. And we have more data on this in the report, but one statistic that we thought was particularly important to share was around the number of people and families with kids in Colorado shelters. And we saw that number increase by 16% between 2020 and 2021. So not surprising with some of these economic numbers that we are seeing here, that families are having trouble keeping roofs over their heads. So we've shared a lot of data on some pretty dire economic circumstances for families with kids throughout the pandemic, but there are some really important policy changes made at the federal level as part of pandemic relief efforts that really helped shield kids from even worse economic fallout. The expansion of the child tax credit in particular kept millions of US kids from falling into poverty during a time of widespread economic turmoil. And this policy change is really a perfect example of how powerful impactful policy change can be in the daily lives of our kids and families. So just a little background here on the child tax credit. It's been around for a while, but the American Rescue Plan passed in March of 2021, made some temporary changes to it that benefited millions of families across the country. It did things like increasing the amount of the credit from $2,000 per child to $3,600 per child for kids under 6 and $3,000 per child for kids 6 and older. It raised the age limit for eligible children. Maybe most importantly, it provided these payments monthly instead of in one big sum at tax time so that families could access them and use them when they needed them. And then finally, it also very importantly removed the minimum income requirement to receive the credit, making sure that families with the lowest incomes who had previously been excluded from receiving it were able to benefit from it. And as of December 2021, researchers have estimated that the expanded child tax credit and these policy changes kept 3.7 million US kids from falling into poverty at a time when a lot of other economic indicators were pointing to trouble. And data show that these payments reached hundreds of thousands of people here in Colorado and that they were overwhelmingly used for basic needs. So this is a graph that shows the commonly reported uses of advanced child tax credit payments, those monthly payments among households with kids here in Colorado who received them. And I think this graph shows a couple of things. Again, the payments were overwhelmingly used for basic needs, but it will also show you the power of direct cash assistance to families and how much that can benefit them. A lot of programs that support kids and families, things like SNAP or WIC or Medicaid or the school lunch program, all of those programs are fantastic, but they can really only be used for designated purposes. And the beauty of direct cash assistance, things like these monthly payments, is that families can use it flexibly depending on what their most pressing need is at the time. So if we look at how they were used in August of last year, for example, this is back to school time. We see that a lot of families were using the payments for food. School books and supplies were a commonly used or a common purpose, savings or investments, and then clothing. And then if we jump forward to December of last year, when the Omicron surge was really starting, people were missing work. We see that those uses really shifted, and we see a lot more families reporting using those payments for things like food, rent, and utilities. So those really, really basic essentials that kids need. Now, this program, again, was a huge support to families while it was operating, while it was available, but unfortunately, Congress did not take action to extend these monthly payments. So families are no longer receiving them, and preliminary data indicate that we started seeing that economic hardship really going back up among households with kids after the payments stopped. So I'm going to turn things over to my colleague, Sarah Barnes, who is our Director of Family Economic Prosperity Initiatives, and she's going to talk a little bit more about some of the policy recommendations for supporting family economic security in our state.
Thanks, Sarah, and hi, everyone. Thanks for being here today. So when we think about families continuing to recover from these economic impacts of the pandemic that we've just heard about, we really need to work to ensure that all families have access to adequate income to withstand a sudden loss of employment, unexpected medical costs, unplanned financial challenges of various kinds, and that can also allow them to sustain a basic standard of living and to build wealth. And one really important set of policy strategies to help achieve this goal are in the area of income supports. And as we've just heard about the impact of the advanced child tax credit, these payments allow families to afford necessities. It allows them to work. It allows them to provide care to their children. These income supports also support families' mental health and their ability to set goals and plan for their future. We need Colorado to continue to make meaningful public investments in these income supports for families. And these can include things like TANF, basic cash assistance payments to families, things like the child tax credit, and also other forms of direct cash assistance, including things like guaranteed income programs. Another set of policy strategies that are really important for families with kids relate to housing. And we need to make sure that these housing policies include a focus on families with children, given the severe negative impacts that unstable housing has on child and family well-being. We know that families with children are more likely to face eviction than other groups. And so policy solutions should work to both prevent evictions and also ensure that families have access to adequate legal and other types of supports if they are facing an eviction proceeding. In addition, we should also ensure that families can live in communities where they have access to the benefits of their choice, of their choosing, like childcare and schools, healthy food, places to stay and play, and also that families have avenues to become homeowners in their communities. And with that, I'm going to turn it over to Erica to talk about our next set of data.
Thanks, Sarah. So I'm going to run through our health slides along with Hunter Nelson, our policy analyst here at the campaign. So first in the report, just as we do each year, we look at the uninsured rate for children in Colorado. On the chart, you're seeing the uninsured rates between 2008 and 2019 with Colorado in green. And what we know is that Colorado had made a lot of important progress with reducing the child uninsured rate, but that progress had stalled in the years leading up to the pandemic. The rate had been declining steadily for years and hit a record low of 4% in 2015, but then plateaued and began to climb again amid federal policy changes and harmful racist rhetoric of the Trump administration. And this environment likely dissuaded immigrant families with children in particular from enrolling their kids in health coverage programs that they were eligible for out of fear of facing retribution. So you see on the chart in 2017, our uninsured rate starts to tick up. And then between 2018 and 2019, the number of uninsured kids in our state increased by 10,000 kids. And that was the largest single year increase that we had seen in at least a decade. And so we end at around 6% in 2019. The 2020 uninsured rate is one of those experimental estimates we've been talking about and is not comparable to the previous years of data. But the estimate released by the Census Bureau shows that 5.3% of Colorado kids lacked health insurance. That was nearly 70,000 children, and it was on par, just slightly lower than the national average of 5.4%. We did not get detailed estimates on uninsured rates by race, ethnicity, or by family income in 2020, but we know that before the pandemic, data showed that Black or African American children, multiracial children, and children in families earning between 100 and 149% of the federal poverty level saw some of the largest increases in their uninsured rates between 2017 and 2019. So we'll continue to look at this indicator. We are hoping in 2021 for some more comparability to years in the past, but for now, this is what we know for 2020. We also know that health insurance is just one piece in terms of accessing care. Disruptions associated with the pandemic, like office closures, quarantine requirements, childcare challenges, and fears of contracting COVID-19 likely became additional obstacles for families with kids who needed care. First, Colorado kids saw an 8% drop in receiving routine non-COVID vaccines during the first year of the pandemic. We also know that the share of Colorado children, that's that blue chart on the screen, whose parents reported that their child had visited a healthcare facility or seen a healthcare professional in the past 12 months fell by 8% as well. So, or 8 percentage points between 2019 and 2021. That green pie graph on the lower left represents U.S. parents with children under 5 who were surveyed by the University of Oregon, who reported that their child had missed a well baby or well child visit since the COVID-19 pandemic began. And then finally, in early 2021, we know that 46% of Colorado birthing parents with children between the ages of 0 to 3 reported that their mental health had gotten worse since the onset of the pandemic. And 50% of those reported they were not able to get the needed mental health care. One of the most commonly cited reasons for that was a lack of childcare. So we know that a lot of the disruptions that were related to the pandemic resulted in people, whether birthing parents or children, seeking less care during the first and some parts of the second year of the pandemic. We also look at food security during this time period. So we know that at some points during the pandemic, nearly 2 in 5 households with children, so close to 40% of households, reported that their kids weren't eating enough because food was unaffordable. There were important policies and programs that were implemented at the local, state, and federal levels to fight hunger and food insecurity among families with children. The Pandemic Electronic Benefit Transfer Program, or the PEBT program, was one of them. It provided temporary emergency nutrition benefits to children whose schools or childcare centers were closed due to COVID-19 and whose families' incomes were low enough to qualify. And schools were also able to provide free school meals to all students, regardless of whether their family income qualified them for free or reduced price meals. These efforts likely kept more families food secure during these years, but we still saw between 18 and as high as 37% of Colorado households with children reporting that they were not eating enough food because of affordability challenges. And these numbers come from the Census Bureau's Household Pulse Survey and aren't comparable to pre-pandemic estimates of food insecurity. But we know that at certain points during this time period, we saw a very high share of households with children reporting this difficulty. The health section also focuses quite a bit on mental health of kids and several different populations in our state. So nearly 18 months into the COVID-19 pandemic, I'm sure many people here today are aware that the American Academy of Pediatrics and other partners declared children's mental health to be a national emergency. The CDC reported that emergency department visits for suspected suicide attempts were 50% higher among adolescent girls and 4% higher among adolescent boys in February and March of 2021 compared to the same time period just 2 years before in 2019. In Colorado, we know that suicide rates were rising long before the pandemic brought on additional stressors. In 2020, more than 100 Colorado kids lost their lives to suicide, and that was more than double the number of deaths that we saw a decade prior in 2010. We have some really incredible tools in our state, like the Colorado Health Access Survey and the Healthy Kids Colorado Survey, that allows young people to tell us more about their mental health. According to the Colorado Health Access Survey, nearly 19% of our adolescents between the ages of 11 and 18 reported poor mental health in 2021. That was a doubling compared to what was seen in 2017. And we also know on our Healthy Kids Colorado survey as of 2019 that nearly 1 in 5 of our high school students reported they had seriously considered attempting suicide in the past year. And these rates were much higher among our children who are American Indian or Alaska Native, children who are multiracial, and our female students and students who are transgender. We also saw that the numbers, deaths due to unintentional drug overdoses increased significantly across the United States and also in Colorado during the first year of the pandemic. In Colorado, this increase was noticeable or specifically massive for our youth between the ages of 15 and 24 years old. So what you see on the chart here is this is deaths due to unintentional overdose among that age group. And in just 1 year, from 2019 to 2020, we saw those deaths jump from 74 to 152 in just 1 year. And we know that much of this increase was driven by a significant rise in deaths due to synthetic opioids, including fentanyl. Deaths due to synthetic opioids tripled between 2019 and 2020, rising from 36 deaths to 109 deaths in just 1 year. So we write more on this in the report, but dig into sort of an indicator that we haven't spent quite a bit of time on in years past. Finally, amid a lot of these heartbreaking statistics, one that Sarah mentioned at the beginning is we know that thousands of Colorado kids have experienced the trauma of losing a parent or primary caregiver to COVID-19, and that children of color in our state have been hit particularly hard. So a December 2021 study estimates that 2,100 Colorado children lost a parent or primary caregiver to the virus. Losing a parent during childhood is, of course, a life-altering trauma that can have implications on a child's mental health and their development if they don't receive the support and the help they need. So every single one of these represented in the chart is a tragedy. And we also know that because COVID-19 had a disproportionate impact on communities of color, the children of color are represented disproportionately as well in this chart. So Hispanic children, you see the bar on the far right, 953 Hispanic children lost a parent. They were estimated to make up 45% of the kids who lost a parent to COVID, though they account for only a third of the state's children overall. And similarly, Black children in Colorado made up 13% of the estimated number of children who lost caregivers to COVID, but they constitute just 4% of the child population. So we know that some communities were hit harder by the pandemic, but that holds for this tragic outcome where kids lost primary caregivers that they loved to the virus. I'm going to hand it over to Hunter Nelson so that she can talk through some of our policy recommendations in this section.
Yes, thank you, Erica, for sharing all that important data. My name is Hunter Nelson. I'm a policy analyst focusing on child and family health here at the Children's Campaign. I'm going to talk through some of the ways that we think policymakers can best address the health needs of Colorado children and families based on this year's data. So to respond effectively to the health needs of families and children in our state, we must ensure the strong implementation of recent policy wins to create a special enrollment period for pregnancy so that Coloradans will be able to sign up for individual market health insurance coverage as soon as they find out they are pregnant, and therefore they can access the critical prenatal health services that they need beginning in January 2024. We also want to ensure the implementation of expanding access to Medicaid and CHIP, or the Child Health Plan Plus, as it is known here in Colorado, to undocumented pregnant and postpartum Coloradans, as well as children, so that all families in these critical periods can access the physical, oral, and behavioral health services that they deserve beginning in 2025. And we also want to ensure that child care settings and schools support the social and emotional development of children. We also recommend expanding access to oral and behavioral health services in more locations, including in primary care offices, childcare, and school settings, and also expanding access to key nutritional supports, including ensuring that all Colorado kids have access to healthy school meals. We also recommend strengthening efforts to protect the most marginalized Coloradans from severe consequences of COVID-19 by ensuring access to vaccines and testing, requiring masks in high transmission and high risk settings, and improving indoor air quality at schools and workplaces. So I will pass it back to Sarah to take us to the next part of the presentation.
Thank you, Hunter, and thank you, Erica, for sharing all of that great health data. Next, we're going to move on to early childhood and take a look at how the pandemic is affecting our youngest kiddos, many of whom have lived their entire lives during the pandemic and affected the people who care for them as well. So it's no secret that Colorado's childcare system has long been under-resourced. Even before the pandemic, we did not have enough capacity in our childcare settings to serve all of the families who needed care. And insufficient public investment in childcare has for a long time resulted in really long wait lists for care in nearly every Colorado community, as any parent of a young child can tell you. And there are challenges with recruiting and retaining staff. So all of those things were existing challenges. And then the pandemic hit and providers were facing even greater obstacles to operating, excuse me, at full capacity. And a lot of these obstacles have to do with staffing. A survey that was conducted by the National Association for the Education of Young Children in mid-2021 found that 80% of Colorado child care centers surveyed reported a staffing shortage as of that time period. As a result, 47% were serving fewer children, 40% were unable to open classrooms, 34% had longer wait lists, and 26% had to reduce their operating hours. And so these constraints are undoubtedly affecting families of young kids who need to go to work, who need safe and consistent care for their children, and are often able to access it largely due to these staffing issues. And when we look at compensation or the median wages for childcare teachers, these staffing struggles make a lot of sense. Wages for childcare educators have long been inadequate, and they don't reflect the vital work that these folks are doing and the vital role that they play for not only just our kids, but our communities and our economy as well. And as of 2020 in Colorado, a childcare teacher in our state earned less than $30,000 a year. So woefully inadequate, and also just a fraction of what teachers of children and other age ranges are earning. So for example, childcare teachers earn only about 88% of what a preschool teacher in Colorado earns, and only about 60% of what a kindergarten teacher earns. And as my colleague Melissa, who leads our early childhood work, will speak to in a moment, solving Colorado's childcare capacity challenge requires us to start investing in and supporting our childcare educators through better compensation and benefits. It's going to benefit the workforce, and it's going to benefit our families with young children as well. So we talked a little bit about how the pandemic has created challenges for providers, but it has also caused severe disruptions and stress for families with young children. Anyone who has young children, there are 3 young kids just across our small research team here, so we can attest to this. You all can also probably attest to the childcare struggles that have seemed like almost a daily fact of life since March of 2020. So if you're nodding along to this, the numbers bear this out. It's not just you, you're not alone. We've seen childcare disruptions due to COVID getting more and more common throughout the pandemic. And this graph here shows the percentage of Colorado households with kids under 5 who reported a childcare disruption related to COVID-19 for at least one child in their household in the past 4 weeks. And you can see that that started off high with around a quarter of households with young kids in our state reporting these disruptions in July and August of last year. But then you jump forward to the beginning of 2022, and you see that that number has almost doubled, with almost half of the families with young kids in our state reporting these challenges. And this is going to create immense stress for parents, for employers, because it's very difficult to work with a young child at home. And so these disruptions, unfortunately, we're just getting more and more common and more troubling for families. And we know that they've caused frequent employment challenges for parents of kids under 5, and required people to make some really tough decisions about their employment. So as of early this year, January and February of 2022, the Colorado households with children under 5 who reported Colorado childcare disruptions cause these different employment impacts were really high across all of these categories that you see here. So for example, a quarter of families with young children in our state reported that they had to use vacations, sick days, or other paid leave related to a childcare disruption caused by COVID-19. Almost a quarter reported that they had to cut their work hours, which will have implications for their family economic security. More than 1 in 5 reported supervising 1 or more children while working, which I can tell you from personal experience is not helpful to anyone. And then 14% reported having to take unpaid leave. And finally, 7% reported that they did not look for a job because they had to care for their children in the midst of these childcare disruptions. And all of these categories were much more commonly reported among families with young children than they were among families with kids in the K-12 education system, which really just speaks to the importance of getting support to families with young kids and to childcare providers to alleviate some of this pressure that they're feeling. A separate study also found that these disruptions were not short-lived. Among parents who reported childcare closures in January of this year, almost 40% reported that closure lasted at least a week. So this is not just having to take a day off of work to stay home with your kiddo. This is missing potentially an entire week of work, or cutting your hours, or having to quit your job because your care has been unstable as a result of the pandemic. And with that, I will turn things over to my colleague, Melissa, who is going to talk a little bit about how we can better support the providers and parents and young kids in our state.
Thank you, Sarah. Thank you for presenting today and for all of your amazing work on this presentation. My name is Melissa Mares. I'm the Director of Early Childhood Initiatives at the Colorado Children's Campaign. And the policy strategies here, I think, like Sarah said, many of you live out the importance of early childhood, so I hope that they won't be anything new, but they are no less important just because we're 2.5 years into the pandemic. The first is investments, sustainable and long-term investments in support of children's learning and development. This includes access to high quality childcare and preschool, but not just that, increasing access to developmental screening and referral, expanding early childhood mental health consultation programs, and supporting that critical transition to kindergarten. One thing I would add to this section is just the importance of not only making these investments, but ensuring that we can have access to the data that we need to track our progress and to understand how we're doing in terms of our systems level changes that are happening in Colorado right now. And not only having the data, but being able to look at it disaggregated by race, ethnicity, income, and geography will be critically important moving forward. The next thing Sarah said, I would mention it, and that's true. Our early childhood workforce is just essential, and we need to make long-term sustained investments in them as well. And this means so much more than just sort of your potentially traditional idea of a salary or benefits. It includes access to a substitute teacher so they can take a sick day, sick days where they can get paid to support if their child is sick. Providers say they can't take sick days to support their own kid, access to health insurance, retirement, and mental health support, because caregiving is a mental health burden and we need to continue to think about it that way. And then I think that we have an opportunity in our state to really push the narrative further. It's been going on for decades with the transformative creation of our Department of Early Childhood. We're really at another inflection point. And I know that we at the Children's Campaign look forward to doing work for the workforce. The last recommendation I'll mention today is centering the family, caregiver, and provider voice, specifically in the implementation and decision-making process of our new Department of Early Childhood. And I know that they're aware of this already, but just so everyone knows what we mean by this as the Children's Campaign, we mean meaningful, supported, and compensated engagement of families, caregivers, and providers in implementation and decision-making processes as this moves forward. We recognize that context and lived experience is so critically important to our work being successful together, and that we need to make sure that we're thinking about setting up our systems to recognize that. And I will send it back to you, Erica.
Thanks, Melissa. I'm going to walk through our K through 12 education slides. Just a reminder we put in the chat. If any questions come up, feel free to put them into the chat. We've saved time at the end to respond to anything, so you're welcome to put them there for now. So in our K through 12 section, one of the first things we look at is enrollment in our public schools. So pre-K through 12 enrollment numbers increased in fall 2021 by about 3,000 kids, but they still remain far below pre-pandemic levels by nearly 27,000 students. So we still see enrollment numbers significantly lower than what we saw in fall of 2019. And that 2021 enrollment data also show a likely undercount of kids who are eligible for free or reduced price lunch, also called FRL, in our state, and another indicator that dipped for the second year in a row. So 37% of our state's pre-K through 12 students were identified for free or reduced price lunch in 2021. This was down from 40% in 2020, a decline of more than 25,000 kids. And the drop in 2021 was concentrated among free lunch eligible kids, those kids in families with the lowest incomes. So those are the kids represented in the dark green bars you see between 2020 and 2021. We lose more than 20,000 kids who are eligible for those lunches. The significant drop is unlikely to reflect more Colorado students being financially secure. As Sarah Hughes and Sarah Barnes were talking through at the beginning of the presentation, all those economic indicators tell us that families are less financially secure than they were. Rather, this is likely a reflection of several other factors, including lower enrollment overall, a shift in federal policy to provide universal school meals temporarily to all children, but also difficulty collecting paper FRL forms from families in remote learning environments, and other longstanding shortcomings of our existing method for measuring student poverty. And so we look at sort of the shifts in both these populations, kids who are eligible for free lunch as well as reduced price lunch. We also look at the CMAS results from spring of 2021. The results should be interpreted with quite a bit of caution given significantly low participation rates in 2021. So just as a primer, in spring 2021, CMAS ELA was given to students in grades 3, 5, and 7, while the math assessment was given to students in grades 4, 6, and 8. So that change, coupled with a drop in participation rates, limit our ability to understand how kids did on the CMAS. We know that while the pandemic likely had significant impacts on student learning, the critical differences in the samples of students tested by CMAS between 2019 and 2021 means that the results are not comparable. And many of you will remember that in 2020, the assessments were canceled. But when we just look at 2021, we know that less than 50% of students met or exceeded expectations on the assessment that they took. Within subject areas, 5th grade ELA students saw the largest share of kids scoring proficient, along with 8th grade math students. Our 3rd grade ELA students and 6th grade math students saw lower shares of proficiency within those subject areas as well. On this slide, what you're seeing are participation rates. So this is essential to, this is essential to those proficiency scores on the previous slide. So you'll see the reason that these results aren't comparable in 2019. Those blue bars represent the participation rate by grade and subject on the assessment, and the gold bars represent this change in participation for 2021. Specifically, the older grades saw some of the largest drops in participation. So if you look at ELA grade 7, participation fell by 28 points, and in math grade 8, it fell by 31 points. So this is why the scores are not comparable, because these are two very different samples of kids being tested across years. But understandably, in spring 2021, there was still a lot of fear around the COVID virus and going into school to test, and understandably, there were families that felt that they did not want to send their kid in to test. So these are the data we have from that time. Finally, we also look at the Colorado's on-time high school graduation rate. In 2021, it dipped slightly for the first time in more than a decade. So the percent of students graduating on time in Colorado fell from 81.9% in 2020 to 81.7% in 2021. Students of color whose families have been disproportionately harmed by the pandemic's health and economic impacts saw some of the largest declines in their graduation rates. So a lot of that, though the state decline was small, it was concentrated among our students of color who have historically been placed the furthest from educational opportunity. So you'll see on the chart here, Hispanic, Latino students and American Indian, Alaska Native students saw rates drop by more than 1 and 2 percentage points respectively. So large drops, and then also students who were 2 or more races or Black or African American saw drops that were larger than the state drop in between years. We also know that other groups of students who have historically faced more barriers to educational opportunity also saw larger than average declines. So students who are migrant, students who are homeless, students with limited English proficiency, and students who are economically disadvantaged all saw on-time graduation rates fall pretty substantially. Students who are migrant, that is the largest fall we saw across the board, nearly 5% lower in terms of on-time graduation. The last area we look at in this section is immediate college enrollment. So this is high school seniors enrolling in college for the following fall semester after graduating. That fell in Colorado as well overall, and we saw disparities between rural and urban students hold. So in 2020, the share of Colorado graduates who enrolled in post-secondary education for the upcoming fall semester fell to 50.5%, and that was a decrease of almost 6 percentage points compared to 2019. That enrollment rate for our state's high school seniors was also significantly lower than the national average, which was at 63%. Rural districts continue to see immediate college enrollment rates lower than the state average. So you see on the right-hand side of the bar, rural graduates, we saw 47.3% of them immediately enrolling in college. But specifically small rural districts, they saw 43.2% of 2020 graduates enroll in college for the fall. And that was a decrease of nearly 10% compared to what they saw in 2019. So the disparities between graduates of different district settings held, but particularly for small rural graduates, we saw this gap widen, and we saw that figure fall further in 2020. I'm going to pass things over momentarily to Riley Kitts, who's going to talk through our recommendations for improving our K-12 education outcomes.
Thank you so much, Erica. Hi, everyone. My name is Riley Kitts. I'm the Government Affairs Director for the Children's Campaign, and I'm here to talk about some policy recommendations we are exploring to improve K-12 outcomes for Colorado kids. And these include, as you heard earlier, across other areas of our portfolio, ensuring strong implementation of recent policy wins. So first off, for school finance, we need to enact a new, more accurate, and more holistic measure of students experiencing economic disadvantage. And we need to devote significantly more resources to students living in poverty. We also need to dedicate more state funds to address disparities between low and high wealth school districts to ensure that educational opportunities and resources available to students do not differ based on where they live. Some of our policy recommendations also include investing in comprehensive behavioral health supports and data collection efforts that both adequately measure and respond to students and educators' social and emotional needs. Especially as the pandemic wanes, students and teachers need multi-layered supports from their schools. And lastly, we need to ensure transparent and easily accessible reporting on state and local uses of funds that we received through various federal stimulus packages, whether that be the CARES Act or the American Rescue Plan. That way, Colorado will be able to tell a story about what worked in our pandemic recovery and what didn't for students. While state dollars have been mostly allocated for various purposes, local education agencies can spend funds through 2024, and they can target dollars to the opportunities and resources students need to thrive. Thank you very much, and I'll hand it back over to Erica.
Thanks, Riley. We want to thank you all so much for joining us today. And before we jump into any questions that we might have, we just wanted to ask for you to join us in our work to make Colorado a better place to be a kid. We know that the effects of the pandemic on our state's families have been significant, and that many that you saw today are truly heartbreaking. And I know for us as a research team, there have been moments where looking at the data has been hard from the last few years to sort of to know the experiences that our families have faced during this time period. But we also believe that some of the most important and innovative work that's done by advocates comes from when we face our realities head on and tap into the passion and the lived experience that brought us to this work, and dig deep to look for solutions. And so we're honored to work with the people who are here today in some way. And we hope that you'll find new ways to engage with us as we work to respond to the needs of kids and families because of what they've been through. So first, if you haven't already, we would encourage you to sign up for our Kids Flash weekly newsletter. Through Kids you can get regular updates on issues affecting kids in our state, as well as our work at the Capitol during the legislative session. We'd also welcome you to attend our connection reception on September 15th to learn more about how we do our work. Look out for the 2022 Campaign for Kids materials, which will outline the most important issues for kids and families in the upcoming election, and give you some talking points to connect to your local candidates to see where they stand on those important issues. And finally, we invite you to come join our It's About Kids network and share with us the challenges and solutions in your local community and county. A lot of what makes our work inclusive and responsive is driven by the relationships that we have with people like you and with people across the state. And so we would invite you to join us in our IAK network if you have that capacity. So I will hand it back to Sarah. I believe we're going to take any questions now, and just thank you all for listening to us go through all of this.
Yes, huge thank you to you all for spending the last hour plus with us. And we really hope that the data that you heard today is going to be helpful in the amazing work that you're doing in every corner of Colorado to help make it a better place to be a kid. As Kelly and Erica have mentioned, if you have questions that have come up throughout the presentation, you can feel free to put them in the chat and we will do our best to direct them to the appropriate person. One question that I've seen come up so far is, will we send these slides out to people? Great question. We will have a recording on our website shortly of today's presentation. And then I am not a Zoom aficionado, but I think there should be a way for me to get a list of everyone who has attended today and be able to send out a PDF of the slides. So I will do my best to do that. But if nothing else, there will be a recording posted on our website. And I'm seeing a couple questions here. Number one, are there any comparisons with national data? Thank you, Rebecca, for that question. It depends on the indicator. As Erica mentioned, we sort of had to get creative with our data sources, still using things that are very reliable, but just sort of drawing on different data sources than we have in the past. And so with some of these indicators that you've heard about today in the report, whenever possible, we'll include those national comparisons. So for example, with our uninsured rate, with our child poverty rate, we have national comparisons. Other surveys don't allow for those types of comparisons, but we do try to include them whenever possible. Another great place to go to see data for Colorado compared to the nation is our Kids Count Data Center, which you can access either via our website or by going to datacenter.kidscount.org. That is a great place. It's a site that's hosted by the Annie Casey Foundation that we also upload data to, and it will provide, again, whenever possible, US data and Colorado data as well. I'll share, Heather has a note of context to share. She notes that many Coloradans have been locked into Medicaid between 2020 and 2022 with the federal declaration of the public health emergency, and the state data on Medicaid and the public health emergency impacts will be important to consider as the data for uninsured children will likely be impacted for the next couple of years. Yes, thank you for mentioning that. That is something that we talked briefly about in the report and something that I know our health policy team here at the Children's Campaign has their eye on, because that provision that has kept people enrolled in Medicaid has really been helpful in preventing kids and families from losing their health insurance coverage. So thank you for sharing that. And thank you to the Children's Campaign staff that have been dropping links into the chat while I've been talking. I'm not skilled enough to type and talk at the same point, so thanks for that. Other questions? All right, well, seeing none so far, we will go ahead and get wrapped up today. Again, just want to thank you all so much, not just for attending today, but for all of the work that you do to use these data and get them in the hands of people who can use them. If you do have questions that come up after the call, my contact information and Erica's contact information are both listed here. We welcome your questions anytime or your suggestions about what other data would be helpful to include in next year's Kids Count as we start to look ahead. But thank you again for the time today, and thank you for the great work that you do for Colorado kids.